What is an abscess and how do you treat it? An abscess is a collection of pus that forms in an infected area. Abscesses can occur in any part of the body but are most common in the feet, legs, and groin. Abscesses are usually treated with antibiotics and a drainage procedure. If the abscess is not treated, it can become large and cause significant pain. If you think you have an abscess, contact your doctor immediately. What is an abscess? An abscess is an infection that develops in a restricted area of the body. Abscesses, also known as pus pockets, can occur in any part of the body but are most commonly found in the armpit, groin, or neck. Abscesses are most commonly caused by bacteria, but can also be caused by parasites or fungus. If you catch an abscess early, you can often treat it without antibiotics. However, if the abscess becomes large, infected, or pus-filled, antibiotics may be necessary. Treatment may also include draining the abscess, antibiotics, and pain relief. If the abscess is in a difficult-to-reach place, surgery may also be required. How do you treat an abscess? An abscess is a pus-filled mass that can form anywhere on the body. Abscesses can easily become infected and require prompt treatment to prevent the infection from spreading and worsening. Here are the steps you should take to treat an abscess. Clean the affected area with soap and water. Apply an antibiotic ointment to the abscess. Apply a bandage to the abscess. Keep the area clean and dry. What to do if you can't treat an abscess? Abscesses can be a real pain, but don't despair. There are many things you can do to help get rid of them and relieve the pain. If you can't treat the abscess on your own, then you may need to go to the hospital. Abscesses can form from any number of sources, including a cut, wound, or infection. If left untreated, an abscess can cause a lot of pain and can even lead to further infection. Here are some tips on how to treat an abscess. Clean the area with soap and water. Make sure to get inside the wound and around any pus or debris. Apply an antibiotic ointment or cream to the area. Apply a bandage to the area. Elevate the area if possible. Keep the area clean and dry. Drink plenty of fluids to help flush the infection out. Take ibuprofen or other painkillers as needed. Contact your doctor if the abscess does not improve within a few days or if it becomes infected. How to prevent abscesses? An abscess is a collection of pus and fluid in a localized area. It can occur anywhere on the body but is most commonly found in the neck, armpits, and groin. Abscesses can be caused by a variety of things, including a cut that becomes infected, infected bacteria spreading through the body, certain types of cancer, bacteria getting into the body through the nose or mouth, a foreign object getting lodged in the abscess. There are a few things that you can do to prevent abscesses from occurring. First and foremost, make sure to keep your cuts and wounds clean. If you do get an abscess, make sure to get it treated as soon as possible. Here are a few tips to get you started. Clean the wound with soap and water. Apply a cream or ointment to the wound. Suck out any pus and fluid that accumulates. Apply a bandage. Take antibiotics if the abscess appears to be caused by a bacterial infection. If you do get an abscess, make sure to see a doctor as soon as possible. There are a variety of treatments that can be administered, and depending on the severity of the abscess, the doctor may need to surgically remove it. 5. Tips for treating abscesses. Abscesses can be a really nasty complication and can be difficult to treat. Here are a few tips to help you get started. When you first see an abscess, it's important to rule out other causes.